In this video, you're going to hear from me, an occupational therapist specializing in hand therapy, as well as Elizabeth, a labor and delivery nurse, and we are going to go into depth about most common causes for pregnancy and postpartum hand pain, how to tell if you have these conditions, and what to do about it if you have it.
Oh, would you like to introduce yourself, and maybe we can both introduce ourselves and just, I guess, tell everybody like what our background is?
Yeah, I would love to. So, my name is Elizabeth, and I am a labor and delivery and postpartum nurse, as well as a childbirth educator. And I provide educational content here on Instagram, but then also over on YouTube. And I actually also have three children. Kurt and I both have three kids, and both of our names are Elizabeth. So, we're very similar in that respect.
And we're both like really tall, which is like really funny because I feel like on social media you don't know how tall somebody is. But are you like 5'10",
Yeah,
5'11"?
yeah, 5'10".
Yeah,
But you're like, are you 6 feet tall?
I'm 6 feet. I'm 5'12".
Love it.
Yeah, but we're like twinsies. Awesome. Well, I'm Corinne. I'm an occupational therapist, and I actually coach people online with chronic hand pain and ways to decrease their pain, improve their function by exercising, supporting, and protecting their hands. And as Elizabeth said, I have three kids. They're all like similar ages, and so we've sort of been pregnant and postpartum together, like through the craziness. So yeah, it's a lot. And to add on top of all that, like no one should have to experience hand pain, during the sleepless nights and all the
Oh my
craziness.
gosh. Yeah, I feel like a lot of people don't necessarily associate your hand with a part of your body that you're going to experience changes with pregnancy and postpartum, right? Because we expect our bellies to grow bigger, our breasts to swell, maybe some swelling in our ankles and some discomfort in our pelvis. But a lot of my patients, both in pregnancy and as well as postpartum, complain of some hand pain. And so Corinne is going to walk us through some of the really common kinds of hand pain that you might experience. What are the causes, and then what are some solutions that we can work towards to make you more comfortable in your pregnancy and postpartum period?
Absolutely. Okay, yes. And before we really dive into it, I just wanted to give a quick disclaimer that this video is not for an educational and it's just for educational and informational purposes. This does not substitute like direct medical care. And as you'll probably learn, like if you do have hand pain when you're pregnant or postpartum, you definitely should like tell your doctor and like find a good OT or PT to like help you learn solutions and to walk through it. So in my mind, I'm like, okay, I feel like there are two common, like really big ones. And you can tell me if you've like had experience with anything else or if your patients have complained of other pain. But I feel like what's really common is carpal tunnel syndrome in pregnancy, and then like mommy thumb in postpartum. And I feel like mommy thumb is like often just so under the radar, like people don't even know like what it is or that it's a thing, or maybe they just think it's like completely unrelated like to caregiving, but it's like very directly correlated with that postpartum phase. So I'm happy to we could talk about carpal tunnel first, since
Yeah,
you're pregnant before your postpartum.
I think that's perfect.
Okay, awesome. So I just wanted to start with a few facts. So like only 4% of the general public adult population gets carpal tunnel syndrome, but it disproportionately affects pregnant women. And Elizabeth, that's what you were saying. Like you have seen a lot of patients. Like, do you see your patients only like in labor, or do you ever see them before?
So I teach childbirth education classes through my hospital. So I see a small group of people before, during their pregnancy, where I do hear about common complaints that are kind
I
of
got
related
you.
to their
Okay.
pregnancy. But the majority of my patients I will just see in the hospital for their births. Yeah.
Okay, cool. Yeah. So you have like experience though with pregnant women complaining about carpal tunnel. So it normally
hmm
only affects about 4% of adults, but it can affect anywhere from 31 to 62% of pregnant women. It usually, yeah, I know, it's nuts. Usually only happens like in the third trimester. And what's funny is like, did you ever have carpal tunnel when you were pregnant?
Did I have carpal tunnel? Sorry, you're breaking up a little bit.
I'm sorry.
No, I had a lot of other unpleasant pregnancy related problems, but I never had any hand pain at all with my pregnancies.
That's amazing. That's great. So I never got carpal tunnel syndrome anywhere but for with first, and it was literally before I lived with her was I started to get carpal tunnel syndrome. And so I was one of those 31 to 60%, but luckily I delivered and it was gone, like literally in a day. But I want to talk about what causes carpal tunnel syndrome, like why this is so much, like the discrepancy, like that affects pregnant women so much more than the general population. So pregnant women have increased blood volume. And so during pregnancy, as you probably know, Elizabeth, I think I read somewhere that your blood volume doubles. Is that right?
I would have to look it up, but it goes up dramatically to supply blood flow to your baby, and your baby is getting all sorts of wonderful things from the blood flow, but it goes up by a whole heck of a lot.
Yeah. So because of all this blood volume, that's extra, and it probably increases like as your pregnancy increases. This increased blood volume actually causes swelling in your blood vessels. And then our carpal tunnel is a very tight space. So our carpal tunnel is right here, and like underneath our carpal tunnel, we have 9 tendons and 1 nerve. So there's 9 tendons that have to run through like basically a pea-sized tunnel. And so when there's extra blood volume running through like your hand, all of that can put extra pressure on that tight space. And then those tendons and all of the extra blood volume puts pressure on the nerve. And so that is what causes carpal tunnel syndrome in people that are pregnant. And so some common signs might include that you have hand pain, hand numbness, and hand tingling, but it is probably occurring in your thumb, your index finger, your middle finger, and then only half of your ring finger. So if you have numbness or tingling on this side, like especially in your pinky, it's probably not carpal tunnel syndrome.
Okay, because that was a question that somebody actually messaged me. They're like, hey, my pinky specifically is numb and tingly, and that was happening during pregnancy and then went through into postpartum. And this person was saying that this issue, was told it was due to swelling during the pregnancy, but it's actually continued into postpartum. So is that another tendon that has been pinched?
That is like another nerve. So that's the ulnar nerve. So our median nerve, it goes through our carpal tunnel and kind of serves like for our sensation for like this half of the hand. The ulnar nerve, a common site of like impingement would be the elbow or like the cubital tunnel, which is like when you hit your funny bone and then you get a zing through your hand. So it's that groove right there, that ulnar nerve goes through this groove all the way up to this half of your ring finger and then your pinky. So it sounds like that person has cubital tunnel syndrome. I feel like that's less common. Like I haven't heard as much about that, but I mean, it makes sense that like the increased blood volume could put pressure over here, and then like maybe even it sucks that it didn't resolve like once baby was born and like once blood volume got back down. But it maybe relaxin is also like contributing to it. Like our muscles and our ligaments and everything's looser, and so like maybe that nerve is like still just fired up. But for ulnar neuropathy or for like that cubital tunnel syndrome, usually finding like a good elbow pad to wear to protect that area, basically to stop it from like getting, like if you're leaning on it, you want to like stop leaning on your elbow, and wearing an elbow pad can also help to like protect that area. As well as there's like a few nerve glides too, but definitely hopefully like this person got PT or OT to help address that.
Yeah, that's really good to know. So anytime you're having numbness, tingling, pain in your hand, we want to be seeing hopefully PT or OT to help address that. And also, I just had a really stupid thought that I wanted to share.
Not stupid.
Carpal tunnel, right? It's like the tunnel is being blocked, right? There's swelling in the tunnel, like literally like a tunnel that all these things are running through that's causing the issue.
Absolutely. 100%. Yeah.
Realize it's also like a tunnel. So that's
it is like a tunnel. It is, I know. And so when they do a carpal tunnel release, they're actually like trimming away part of that tunnel to relieve the pressure.
Okay. And is that like a surgical procedure that some people have?
It is. Yeah. Usually that's like laparoscopic. So it's like an outpatient surgical procedure. But before you even consider surgery, it's so good to like practice conservative measures or like doing like therapy stuff that we're going to talk about today. And so anytime like you're having numbness or tingling in your hand, that's a sign that you have like that's nerve pain. So that means that one of your nerves somewhere is being impinged or like has pressure on it. And the two most common are carpal tunnel syndrome. That's the most common. The second most common is that cubital tunnel syndrome.
Okay.
So carpal tunnel syndrome, again, that pain and numbness like in that half of your hand. And you also like, usually one of the first signs is that you are asleep at night and then you wake up feeling like you have to shake your hand out. And so like sleeping is often something that can like aggravate it, or, you know, you wake up feeling like your hand's still asleep.
Okay, so kind of different from swelling in your body. A lot of times lying down, sleeping might make that swelling go down. With carpal tunnel, we see an increased swelling at night, which can interrupt your sleeping pattern.
Yeah, and actually a lot of it probably has to do with wrist position. So a lot of people like might sleep like this, right? Or like, yeah, like in a funky wrist position. And so one of the best ways to combat carpal tunnel syndrome is finding a good wrist splint to even just wear at night. Like wrist splints can be really bulky during the day, and it can be hard to wear them like all day. But even just starting with one at night and seeing if that like helps you as you wake up and you're like, my hand, hopefully that decreases.
Okay, that makes a lot of sense. What are some other things that people can do? So the splints at night.
Yes. Okay. So yeah. So if you have like a lot of daytime symptoms and you're like it's not practical. Like I recognize, like I have my therapist hat where I'm like, yeah, just wear a splint all day. But then I have my human hat where I'm like, no, like that's really impractical. Like people cannot wear a big bulky splint with a metal bar in it all day. So some people find like kinesio tape to be really helpful. And so you can see I have it on my thumb because I just still have like lingering thumb pain. But one of the ways that you can easily tape for carpal tunnel syndrome is to like, you put tape right here, and then with kinesio tape, it actually stretches. So you can stretch it like really big, like right over that carpal tunnel, and then lay it flat here. And so that way, when you stretch kinesio tape big, it actually like helps to lift the carpal tunnel away so that you're having like decreased symptoms. Yeah. So kinesio tape's a great way to like have support during the day. But there's also a lot of things that you can do like in terms of activity modification. So carpal tunnel syndrome, like usually it's like repetitive, like with you're tightly gripping your hands or like typing. Yes, so exactly, texting, all of those things. So looking at like when you have symptoms, looking at like what it was that was causing those symptoms and then seeing if you can change it. A few examples are like widening the handle like on your writing utensil, or like getting like a fat grip on it, or even putting like a fat grip around your toothbrush. There's like, if you are like someone who cooks and cleans, instead of like putting your back into mopping, you could look into like an electric scrub mop, or even like treat yourself to a Roomba vacuum. Yeah, especially when you're postpartum, like you will thank yourself. And then cooking, cooking too can really like aggravate carpal tunnel syndrome. But there's like so many on the market fun cooking utensils and tools, like a food chopper, like using a food chopper, which will then like save you from doing this, and then it just dices all your food for you. Or even just like making sure that your knife has like a nice wide handle and is like extra sharp. They also have like amazing like over the counter, or like on the market, ergonomic jar openers, ergonomic container openers, and then just like thinking smart, like trying to avoid like all of the repetitive movements that cooking requires, especially if you're in like a flare-up of carpal tunnel syndrome. So even using like a food chopper or a blender to like finely dice veggies, or I like to use my KitchenAid to like shred chicken, but just trying to like avoid repetitive motions. And then like you mentioned, like this typing, if you're an office worker, and you probably do have carpal tunnel symptoms, especially if you're pregnant. So like looking at your office setup, and consider purchasing like an ergonomic keyboard. So ergonomic keyboard makes your wrists like more in better alignment. And there's also like a vertical mouse, which you hold the mouse this way instead of this way. And so when you're holding your mouse like with your hand on it, like that puts pressure over your carpal tunnel. But if you are holding your mouse this way, like a vertical mouse does, and it takes all the pressure off of it.
That makes a lot of sense. A couple people mentioned on our reel talking about tendinitis. And
Okay. Yeah.
is that similar to carpal tunnel?
It's actually like, it's totally different.
Okay.
Was it like related to the wrist or more of like the thumb?
It might have been related more to the thumb. I think it was
Yeah.
wrist pain that they were speaking of specifically.
Okay.
So we can touch on that later when we move to mommy thumb for sure.
Yeah,
but one fact, oh, sorry, you go.
Oh, no, you go ahead. You go ahead.
I was just going to say, still speaking on carpal tunnel, one thing that I found really interesting that somebody mentioned, and then I did go ahead and like verify this, is that carpal tunnel can sometimes be related to an underlying hypothyroidism.
Oh,
had
wow.
you heard that before? Isn't that interesting?
No, but did you have like thyroid stuff in your pregnancy?
Yeah,
Or?
so I have hypothyroidism. I have Hashimoto's, which is like an autoimmune hypothyroid, and I have been treated for that before I got pregnant, but it's always a good idea if you develop carpal tunnel, especially outside of pregnancy where it's a much smaller population who have it, that you're chatting with your doctor about maybe what some underlying pathologies could be relating to that. So I thought that was really interesting, that having low thyroid.
Yeah. What are other symptoms like of hypothyroidism?
So hypothyroidism, basically, if you just think about like your metabolism and everything kind of slowing down. So there might be like fatigue, weight gain, irregular, really heavy periods, really dry skin can be a symptom of hypothyroid. For me, my biggest symptom is that we were trying to get pregnant and we couldn't get pregnant because I wasn't ovulating, because my body was kind of trying to protect the things that it could. And so it was like, well, we're not going to get pregnant right now. Like, this isn't a good time for us. It was trying to kind of focus on all the other metabolic drives. So the simple fix for hypothyroidism for most people is just taking Synthroid or levothyroxine daily.
Okay.
So
Nice.
At the beginning of your pregnancy, they do in your blood panels test for hypothyroid. So sometimes it's discovered there if it had been like subclinical before. But I just thought that was super interesting tidbit that somebody shared in the reel. And then I looked it up and it was true. How all these things are connected.
Yes, absolutely. I'm seeing we've got a few questions, but on our live, but someone mentioned like hair thinning as a sign of hypothyroidism too.
Yes, that's another good one.
Okay, so I saw a few, let's see, I'm 2 months postpartum and randomly got thumb wrist pain and it hurts to move my thumb. Okay, we're going to talk about that for sure, or pick up my, don't worry, Katie Ciara, I don't know if I'm saying your name right, but we're going to cover that in just a minute. And someone else asked about, let me see, do we go to a specific doctor for the pain? Yes, that's a great question. So yes, an orthopedic, you want to look for an orthopedic doctor or an orthopedic surgeon that specializes in hands or upper extremities. And just because they're an orthopedic surgeon doesn't mean that they're going to jump right to surgery. Usually you just need to go see somebody that will then prescribe like physical or occupational therapy.
Mm-hmm.
Yeah,
you can always start off with asking your OB for a referral out if you need help kind of navigating the system.
Oh, okay. That's a great idea.
I know a lot of us of childbearing age maybe don't have a PCP, maybe aren't like, you know, we only really jumped into the taking care of ourselves game because we're now pregnant. So I don't know if that was you, but I like literally just got a PCP.
Yeah, I like didn't have a PCP. I was like, my midwives like are my PCP, but like no.
no. So they can be a great jumping off point. Before we move to mommy thumb, were there any other good questions? Because I wanted to talk a little bit about carpal tunnel in labor.
Oh, okay, that's a great point. I don't see any other questions, but if you guys have any other questions about carpal tunnel, I'm going to share just a few more tidbits about it, and then we'll talk about it during labor. So if you have any, we can just, we'll like look for them before we move on to mommy thumb. So I also want to talk about like anti-inflammatory foods and supplements, because with swelling, carpal tunnel syndrome is driven by swelling, especially in pregnancy. And so looking for like natural ways to like decrease the body's inflammation can be helpful too. Like the Mediterranean diet is usually like a widely accepted form, or not even strictly adhering to it. It's just more like guidelines. But you can look up like, I don't know, a few Mediterranean diet recipes and like try to start incorporating those into your meal times. And then also like turmeric is a great supplement to take, or ginger, as well as fish oil. Those are all like some just like anti-inflammatory supplements, but please talk with your OB or your doctor before you start to take any supplements, and especially if you're on medication too, because they might interact. One more thing is I wanted to just show you a nerve glide, and maybe we could all do it together. So nerve glides are a way to glide that nerve. So remember, our carpal tunnel it's a pea-sized tunnel, and it's got 9 tendons and 1 nerve in it. And what happens is that nerve just gets like crammed up around all those tendons and all the extra blood and all the swelling. So moving your hand and your wrist in a way to like glide the nerve, almost like flossing, like if you can picture flossing out a bunch of gunk in your teeth, that's what we're about to do with our nerve glide. So what you can do is you can start with your hand in a fist, just about here. Like we're not all the way up here or anything crazy, just maybe hand at shoulder level.
Okay.
And then you're going to open up your hand, and we'll start slow, but usually this will be like a continuous motion. Once your hand is open, you're going to open up your thumb, and then you're going to bring your hand back like you're a waiter at a restaurant, and then you're going to bring it around to face you, and then you're going to lower it. So I'm lowering it
because we're
next
serving
to my body.
food.
Yes, after serving the
presenting
food.
and serving.
Yeah, so we can do that again, just sped up a little bit. So we're going to be here, and then fingers open, thumb out, wrist back, hand around, and then serve the food. And so with any nerve glide, that focuses on the carpal tunnel, but there are a lot of other nerve glides for the median nerve. Like YouTube has a bunch of tutorials. There's also ulnar nerve glides, which if you have cubital tunnel syndrome could be great. With any nerve glide, you want to start low and slow. So low meaning like don't do 20 in a row, just start with like 4 or 5 and do them nice and slow. And then you can increase to like maybe 10 reps in a row a couple times a day. And they shouldn't be contributing more to your symptoms. They should help it feel better. So if it's like flaring it up in there, then it might be too much of emotion. And so you can focus on the other things before you add that in.
Awesome. I love all of these different approaches that you're taking to kind of address carpal tunnel, because I feel like for a lot of us, maybe our OBs were like, oh yeah, sometimes it hurts being pregnant.
I know. And to me. Oh my gosh. Like why do you have to normalize pain like that?
Yeah, just because it's common doesn't mean it's normal, right?
Right.
And I feel like, especially with the mommy thumb, which we'll talk about in a bit, people don't even realize that it's common. They don't know what's going on. Yeah,
absolutely. Well, I'd love to hear like what experiences you've had with clients like in labor with carpal tunnel.
Yeah, so obviously end of your pregnancy, kind of your swelling is at its highest that it's going to be. So a lot of times we do see patients coming in complaining of carpal tunnel pain. And so with that, you might be wearing your splint if it's like an induction in that early part of labor, but as things kind of take off, that probably is going to be coming off. We like to feel a little bit unrestricted as long as that's not causing undue pain and discomfort. And so we're going to be doing some modifications. The first thing is you should definitely let your nurse know if you have carpal tunnel pain, just so that we are really aware in our body mechanics and how we're helping you up and how we are helping you change positions, or even placing your IV, being really aware of that discomfort in your hand and your wrist. We have a lot of modifications that we can do just based on how your labor is progressing and based on that pain. For example, obviously we love being upright is great. If you're having a hard time using your arms to support yourself, like leaning over, you might choose a upright birthing position, like using a birth ball and doing hip circles on the birth ball. That kind of leaves your wrists free. If you want to do a squat, but you're having like a hard time holding onto something, if you want to put up like the squat bar on the bed and lean over that on your armpits to kind of do a squat that way we're not using our wrists.
Wait, I'm sorry, this is just so amazing. Like, I feel like you are like an OT. Like, if someone has carpal tunnel, you're like, okay, I'm putting my OT brain on. Like, let's talk about positions. It's amazing because you don't want to put pressure on that wrist. So that's perfect. I love all of these.
Yeah, and so many labor positions that you see are people like leaning over right on hands and knees, right? That's not going to feel good if you have carpal tunnel. So it doesn't really feel good even for if you don't have carpal tunnel, to have a lot of pressure on this
Yeah.
joint here. So what I like to do is put the peanut ball up in the bed, which is the ball that's kind of long and shaped like a peanut, and then hands and knees, but draped over that. And that way you can even have some motion, some rocking back and forth
Yeah.
on that, and protecting those wrists. And then of course too, when you're getting your saline lock or your IV placed, we're going to avoid this area. Some facilities don't like to put IVs here because there are a lot of nerves and stuff that you can accidentally touch with an IV that are really, really uncomfortable. So request to have ideally something up in your forearm that is still out of the way when you're moving around and nursing your baby or holding your baby later, but that isn't in the wrist is going to be something that can be really beneficial. Those are all my little modifications.
Wow, those are incredible tidbits though. So is this just like from experience that you like know what to do, or is it just so many people come in with carpal tunnel that you're kind of like, okay, how can we take the strain off the wrist like right away?
A little bit of both. And I think even if you don't have true intense carpal tunnel, you'll notice that your wrists and your arms get really sore supporting your body. So it's both things that I have done myself because they were more comfortable, and also things that I've helped encourage my patients to do if they have intense carpal tunnel.
Okay, that's amazing. I literally never thought of that. Like the only pain that I ever registered in labor was like labor pains. Even though like I'm sure that my like hands were hurting, like I'm prone to hand pain anyway. But that's so interesting because you're right. Like most people's go-tos are like, okay, like I'm just gonna brace myself like with my hands on whatever I can get.
Yeah, we gotta keep those nice and loose so that we're not tensing up to reacting to that pain and then not able to prepare ourselves for contractions.
So then like what my hand therapy books say about carpal tunnel syndrome in pregnancy is that most of the time it goes away after the baby's born. And I'm curious like what your experience is. Like, do mamas come in with like crazy carpal tunnel syndrome and then baby comes out and it's like, oh my God, like my hands are relieved, or like, does it resolve like in a few days that you've seen, or, you know?
Well, as far as swelling goes, typically you're actually a little bit more swollen after baby is born than before, particularly if you've gotten IV fluids or you had a labor epidural, which you often get IV fluids with those. So typically what I tell people just in regards to swelling all over is that it probably is going to get a little bit worse before it gets better, and give yourself about 2 weeks to get back to normal. With the carpal tunnel, I don't necessarily think that it gets worse before it gets better because the blood volume shift that happens. But I do think for most people, it's not instantaneous. I do have a lot of patients who are still wearing their splints to sleep postpartum for their carpal tunnel pain after the baby is born. And so for myself, I had symphysis pubic pain, and the baby came out and I was like, excuse me, doctor, why is this still here? I thought it was going to get better. And she said, you know, you need to give your body a few weeks to kind of recollect itself and reabsorb the fluid and kind of stabilize itself back to how it was before. And if at your 6-week follow-up appointment, you're still experiencing discomfort, then it's time to see a physical therapist for that. So
I do remember everyone being like, we'll just address it at 6 weeks. Like, give your body 6 weeks. So maybe that's similar to like carpal tunnel. Like if you're still having that give your body 6 weeks, and if you're still having it after 6 weeks, then maybe it's time to like revisit that with a doctor.
Yeah. I will say with everything, if it's getting significantly worse or it's like unbearable, don't like sit and be like, oh, I'm going to grin and bear it till 6 weeks. I feel like address it sooner. 6 weeks isn't like this magical number. But it does give us a little bit of perspective that sometimes it does take a little bit of time with the modifications that we're doing to help things kind of heal up.
That makes a lot of sense. Okay. Well, very interesting, like perspective from a labor and delivery nurse. I love that.
Do we want to move on to what happens postpartum for a lot of people that I think they were just hearing about from our collab and our reel?
Yeah, definitely. So oftentimes, and when we're postpartum, we are like constantly lifting our babies. And I feel like the mother's natural way to lift a baby is, and no one taught us this, it must be instinctual, is to like lift the baby with their cute little, especially once they get head control, with their cute little arms like on top of your hand. So your thumbs are like in this L-shaped position. and you're like lifting, I meant to bring a baby doll, but whatever.
Mm.
And you're lifting your baby underneath the armpits and the baby, you know, and so that's putting pressure like right here and right here. And so that is a very specific type of thumb tendonitis that is very common in postpartum. And I feel like you're right, it's not talked about enough at all. The formal name for it is de Quervain's tenosynovitis, but it's literally called mommy thumb, like everyone calls it mommy thumb, because it's so common in postpartum. You can get it from other things like outside of being postpartum. So like I've seen somebody for it like after they were in like an intense CPR course and they were like doing a lot of chest compressions, and then they got de Quervain's just on one side, like the side that they were weight bearing on a lot. But it is very common in postpartum. Other things that can flare it up are like gardening, cooking, cleaning, that kind of racket sports too.
Okay.
Yeah, but
so like tennis.
But how? Yeah, tennis. Okay. And then tennis elbow is like a whole other thing that's more close to the elbow. But so what happens when we're like using our hands like in this way to lift up objects such as our baby underneath their armpits is that we have this spot right below, like on the back side of our hand, right below our thumb. And when you lift your thumb up in a way you can kind of see it, it's like a triangular depression, and it's called the anatomical snuff box, because that is where, you know, you would like snuff like cocaine, you know, you put your, right. And so it creates like this little divot right here. It's called the anatomical snuff box. And it is surrounded by 3 tendons. But that is like the area, and those tendons that surround it can get really inflamed with all of the repetitive lifting. So you know you have it when you have pain or swelling like in that area. And the pain often increases with more movement, like with using your hands. Now, one telltale sign of it is what we call the Finkelstein's test, but it's just a way to test to see if you have it. So I can walk us through that now. So you're going to want to keep your wrist neutral, and then put your thumb in your hand like that, and then put your fingers around your thumb, and move your wrist in this downward position or direction like that. Yeah.
Okay. I feel like a little pull, but it wouldn't really hurt if you had mommy thumb.
It would. If you're feeling like even a slight twinge, like you might have a little bit of inflammation there. Do you ever get pain in that area?
Not that I've super noticed, but
yeah. I mean, it kind of feels like a stretch, but it, like, if you have mommy thumb, like for sure, you will go like ow and like move your hand out of that position as quickly as you can.
Okay.
And that's sense. That's like a telltale sign. So have you seen a lot of people with this, or, well, because you see patients only
in the first like max maybe 4 days postpartum typically, so it's not something that I see a lot of, but I have had a couple people message me about it on Instagram being like, hey, what is this? And I shared on my stories earlier today somebody who did that like a few months ago, and I sent them your reel about mommy thumb because they're like, my doctor doesn't know what this is, nobody knows what this is, like I feel like I'm going crazy, which is something that I saw in the comments of our reel too. And the person who messaged me, she was like, oh my gosh, like I could cry, like I'm so thankful that you showed me what this is. And she's since done exercises and like it has resolved, which is
I'm so glad. Amazing. That's amazing.
Yeah.
Did she get like hand therapy, do you know?
I am not sure. She said that she looked up stretches and stuff on YouTube, but I don't know if from there she also went to physical therapy. But she did say that it has resolved, which is really
amazing
because it's really debilitating what it sounds like, and it can be really,
because you have to use your hand. Yes, you like have, especially like postpartum. And I see Katie, Ciara, I'm so sorry, you said it definitely hurts like sharp pain. Yeah, so then once you've done that test and you know you've got it, then you don't have to do it anymore. Down the road, once your pain is calmed down, that actually can act as like a way to glide your tendons. But when it's on fire, like we want to avoid that motion at all costs. So there are a lot of things that you can do about it, and you don't have to be stuck in your pain. We have to use our hands, and so everything that like I'm going to share tonight about mommy thumb and what to do about it, like you have to use your hands. You can't stop lifting up your baby, and you can't stop doing like cooking for your family or cleaning. So everything I'm going to share are like ways to change an activity or support your hand through it. So similar to carpal tunnel syndrome, you're going to want to like modify how you're doing certain tasks. And so like, all the cooking and cleaning tidbits that we talked about in carpal tunnel syndrome, you can apply to here, like basically avoiding like heavy hand use while it is really flared up. The biggest thing that you can do is changing the way that you're lifting your baby up. So instead of like lifting up your baby with your thumbs underneath the armpit, try to, with your wrists in like a neutral position, try to like scoop baby up, or like have one hand under baby's bottom and the other hand like stabilizing baby's back, and try to lift baby up that way to then maybe get baby on your side, all while keeping your wrists and your thumbs neutral. So definitely try to avoid like that armpit grab, and especially like if baby has like decent head and neck control, lifting her or him up in that way could be beneficial for you for sure. Also, like if you're breastfeeding or bottle feeding, our wrists can get in like really awkward positions while we do that. And so like, do you have a recommendation on a nursing pillow that you really love, Elizabeth?
They're kind of a hot topic in the lactation world as far as if we need them. I am personally a fan of the breast friend, which is the one that clips around you. But for somebody with a long torso like you and I, what I found when I was breastfeeding like a little baby is using the breast friend to clip and then actually putting the boppy on top of it to actually bring baby completely up to the height. And that way you're not having to use your hands and your wrists so much to support baby, but just to guide them. I think when we're using our hands and wrists to support, that's when this would flare up more, right?
Yeah. So wait, what is the controversy, or like why would it not be recommended to use a nursing pillow? Just out of curiosity.
I think there is sometimes with nursing pillows, it's all about getting yourself into a weird contorted position. So the nursing pillow doesn't actually bring the baby up close enough to the breast. So then you're hunched down over the nursing pillow, as opposed to if you do like practice like more of like a laid back nursing position, which again is using your body to support baby instead of your hand.
With your hand and your wrist. Yeah, definitely.
Yeah. So, and with a laid back nursing position and bringing baby to the breast, we can get a little bit of a wider latch. So most people don't really love a boppy in general, most lactation consultants. So the breast friend is great. The boppy is great for other things too, time and floor play. So it's great if you have them and if they work for you. But I think just knowing that you don't have to use a breastfeeding pillow, and if you are able to like stack up some pillows around you and get into a nice laid back nursing position, you can protect all this too.
Yes, that really would take the strain off. I was a big side lying nurser. Because of my like back and my hands and stuff. So yeah, really good tidbit. Very interesting about nursing pillows.
Yeah, who knew, right?
I know. Another idea that I had was also like if you are a bottle feeder, gripping like a narrow bottle for a long time could probably flare up your thumb. So you could even look to like the shape of the bottle, like anything that you're holding, you're going to want it to be wider and ergonomically designed. I believe they do make ergonomically shaped bottles. Have you ever seen any of those before, or like wider bottles?
I mean, yeah, they come in all different shapes and sizes, just like the nipple does too. So I feel like there's a lot of variety and options in bottle feeding. Now you just got to make sure your baby will take it, right? Because sometimes those guys can be pretty picky with what they want to take. But I've seen too, sometimes people will put like a silicone sleeve over a bottle, and that might provide a little bit of extra grip, so you're not having to hold it. You could more like rest it on your hand.
A good idea. Yeah,
and
that's a
good slippery that way too.
Yes, definitely would decrease the strain. So I was like putting myself back in like postpartum Corinne's shoes, and I remember, I know, it's a blur. it's a blur, but pushing a stroller, like rather than gripping tightly with your thumbs and your hands, even trying to like lean on it with your forearms, like with your back or your spine in like a neutral position, but just trying to like push it with more of like your forearms or like your whole arm instead of like your hand and your thumbs. And then if you are blessed with a fussy baby, like I have been, baby wearing is also like a huge lifesaver. Like no task was made to be done. Like cooking, cracking, I cracked like a dozen eggs, like holding Kieran and then cracking with one hand. I don't know, I was crazy. But like our tasks like weren't meant to be done one-handed. And when you're holding baby on one side and doing everything with the other side, like that really puts a lot of strain on your, not just your thumb and your wrist, but like your whole arm and body. So do you have like favorite baby carriers that you love to recommend to people?
Yeah, I really like a sling for little babies. I feel like it just creates this nice little perfect pocket for them. And as Rosie's gotten bigger, I do find it more comfortable for like longer periods of time and wearing baby for like a soft structured baby carrier. So I like the Happy Baby carrier, but I mean, you can get them, you know, they have like so many different brands and varieties, and a lot of places you can get them used too, which is nice because they can be pretty expensive. Did you have one that you liked in particular?
I
You
really
wrapped
like
a lot, didn't you?
I wore all of three a lot. I really love the Lala Boo Soothe shirt. Have you seen that? It's like a kangaroo pouch. It was just easy, especially like with once we already had the first, having like the other kids, like just pop them right in. But I don't feel like that was the most ergonomic thing for my back, and like baby grows out of that pretty quickly. So then I just had like an Ergo Baby that I bought like used from Facebook Marketplace, but it's good. Like it worked well.
No, Ergo is another fabulous one. I couldn't think of all the brands that they have. Kinder Pack is one. Kinder Pack is really nice too. Their sizing goes up a lot, like toddler, preschooler. So if you have a larger child who needs to be worn, and then they also have both standard size and plus sizing straps. So the plush comfortable straps are longer for those who need bigger sizes if they're plus size or if they have a really ample bosom. So those can both be really ergonomic and like comfortable too, which is helpful.
That's cool. I've seen also, and I wanted to look more into it, but there's like almost something that looks like a bolster that you just like wear on your hip, almost like a fanny pack. It's like a bolster that you strap around your waist, and then the toddler or whatever can just sit on it, and your arm is just kind of supporting but not like holding.
Yeah, I've seen those. That looks really fabulous. My toddler, well, I guess Rosie's a toddler, but in my head, she's still a baby.
I know,
but my other toddlers who are 6 and 4 and not toddlers are both huge. And so I can't imagine them sitting on something on my hip, but I think that would be perfect for a literal toddler and not, you know, just older kids.
Like a 1-year-old. Yeah. Like your baby. Yeah. Yes. So I also wanted to show like some hand splint and support options. So typically like what a doctor, you know, or what even like a therapist that at an ortho clinic might recommend is just wearing like a wrist and thumb immobilization splint. But usually those like start up here and come all the way down here, and they're like big and bulky, and there's like this huge like metal bar or like multiple metal bars that like literally you can't move your thumb in. And while I feel like that is like, again, that's my therapist hat. Like, yes, you need to wear one of those for 4 to 6 weeks for the tendons to heal or calm down. But like, then I put my like postpartum mom hat on, and I'm like, that is like literally impossible to do like when you're postpartum taking care of a baby. So having one of those can be helpful. Like if you're like when you're sleeping, to maintain like a good thumb and wrist position as you sleep, as well as like if you're just like Netflix and chilling, or you know, if baby's taking a nap and you want to like put that big brace on. But there are like a lot of like lower profile hand support options as well. Like kinesio tape is my go-to. I really love taping my thumb and my wrist to like support my thumb and my wrist and my hand. And what's cool about this is that you don't have to think about like putting it on or taking it off. Like it's just on you for a few days. And with us moms, like, you know, doing all the things that can be really beneficial. They also make like these silicone thumb supports, or like they're kind of like, I like to call them thumb condoms.
I was thinking that,
Yeah, they also can go like very low profile. They're very flexible and they allow mobility or like movement of your thumb and wrist, but they still just provide like some gentle support and gentle compression too. So I really like those for like the daytime pain. And then just like we talked about with carpal tunnel syndrome, tendinitis is caused by swelling. And so looking at like ways to decrease your swelling, like with your foods or like any supplements, and obviously talk with your doctor before starting a supplement. But I know it's like survival mode most times. And so I usually just could take any food I could get, you know.
Exactly.
And also like hydrating and sleeping. When you're dehydrated and you're not sleeping well, your brain literally experiences or tells your body that you're in more pain. But like when we're postpartum, like we're dehydrated and like often, and we're not sleeping well often. And so that can also be like contributors to why mommy thumb can hurt so bad too.
Yeah. Well, if that's not a good reminder to drink, then I don't know what is. I'm going to take a little sip of,
of my drink. I hope everybody joins in sipping.
Speaking of hydration, somebody in the chat here mentioned that hand expressing is something that could trigger mommy thumb. I would think using so physically hand expressing on the breast, like pushing back, squeezing together, expressing your milk. But then 100%. If you're using like a hand pump versus an electric pump, or even if you're like trying to hold the pump onto yourself. So some modifications, if you are expressing, is to get a hands-free pumping bra. One of the ones that kind of like goes around and zips up is my favorite. So that you are completely hands-free when you're pumping, ideally.
You bought me one of those. Yeah, that was one of your first gifts to me. Yeah, they're amazing.
I did. Yeah, I love them. And they're like $30 at Target, and they really can make a big difference. And then you can multitask while you're pumping too, which can be really beneficial. And for some people who maybe really like just pumping on one side or the other at a time and not doing both, most electric pumps can be done on just one side or the other. So you don't always have to pump both breasts if that's not something that's comfortable for you. But I think switching from an electric to hand expressing or manual pump would definitely help with that strain.
Yeah, that's awesome. That's really helpful. And I like often forget about that side of things. Yeah. Well, do you feel like there were any more questions or anything that we missed? Like in I know our real comments. I see a question from somebody. How do you keep your thumb from getting stuck out, like trigger thumb? I have a trigger finger guide, Bust Your Trigger Finger guide in the link in my bio, and that goes over a few thumb exercises that you can try for trigger thumb. I would expect that trigger thumb, I feel like when you're postpartum, like you're more susceptible to everything. And so I do feel like, you know, if you're going to get trigger finger or trigger thumb, it's probably going to be postpartum.
Oh my goodness. Yeah. And I feel like nobody really prepares you for being painful after baby arrives. So I think that this is super helpful to just go over like, hey, this is something that is common, but not normal, and not something that we should just sit with and be like, this, you know, this is just how my body feels now. Like, I think really how important it is, and the education that you're providing in that hand OT space, that occupational therapy for hands isn't just for when you're, you know, 80 and you're crippled with arthritis, but it might be for when you're 20 and you've just had a baby and all of a sudden it hurts when you pick your baby up. Like,
absolutely,
things nobody tells you about before you give birth, or at least things I had no clue about before I had a baby.
And even just knowing that it's like common and that it's not normal, but that you're not the only one going through it, and that there are things that you can really do about it is really helpful. Yeah. Okay. Well, I feel like that concludes tonight. Do you have any like last questions or thoughts or anything?
So I still have a tunnel in our body that is called a tunnel, and that's just really funny to me. But now no other like legitimate thoughts. I just never put those two things together.
You're like, it's a tunnel.
It's literally a tunnel, and that's why it's called a carpal tunnel.
Yes.
Like, maybe I'm dumb, but I never thought of it that way.
That's awesome. Yeah. Well, it was so lovely to talk to you about this and this
Yeah.
shared space, and to also like, I feel like we just hung out like as friends too. So it was great. We should actually catch up soon though, sometime.
We definitely need to when all of our kids are healthy again. So
That might be like in 8 months, like,
perfect. We'll see you
yeah.
then.
Okay, I'll pencil you in. Okay. Bye. Thanks everyone for joining.
Bye. Thanks, guys.
That's it. Thanks so much for watching, and make sure you hit that subscribe button if you found this video helpful so that you can see more videos just like this one.